So hello, everyone. I just wanted to give a big shout out and thank you to the MACVPR for having us be another sponsor for you guys at the show. For those of you who do not know, I'm Lauren Clark. I'm the ScottCare representative for the Northeast. And as some of you may have heard, we also recently partnered with Chanl Health, and we wanted to talk to you a little bit more about that today. So it's my pleasure to introduce to you Barb Fagan.
So good morning, good afternoon, good evening. I don't know what time it is when you're looking at this, but my name's Barb Fagan, and I probably know many of you through my very long, I'm going to date myself, long career in cardiac and pulmonary rehab. I've known you as a colleague, as a clinician, through my work with AACVPR, but mostly I'm very happy to say I know many of you as my friend. So we are super excited to talk to you a little bit about virtual healthcare and how you can truly reach more patients. So most of you know this isn't new. We've been talking about virtual home-based. It used to be called home-based. We're really removing the word home-based, virtual, remote, hybrid rehab. It's all about accessing and reaching more patients. Many of us have experienced this past year our programs being either shut down or we've experienced reduced volumes. And I'm happy to say programs are reopening, volumes are coming back to pre-COVID. But what we don't want to have happen is none of us want to go back to how it was. And when we say back to how it was, what we're saying is we no longer want to be excited and celebrate the fact that we reach only 2 out of 10 eligible patients to attend our on-site rehab. So what we're talking about today isn't a COVID solution. It certainly helped during COVID, but a virtual hybrid approach truly is all about access and how can we reach more patients and deliver this amazing solution called cardiac or pulmonary rehab.
So one of the questions that I do hear a lot is, what if we don't have the staff to cover this hybrid solution?
That's a great question. And so anytime we do something new or different in our cardiac and pulmonary rehab programs, there's a little bit of fear or anxiety about how can we do this. The way I delivered cardiac rehab, oh gosh, 30 years ago when I first walked in, it doesn't even remotely look like what we're doing now. And every time we made a change, it was like, there's no way. We can't possibly, complete our class and our paperwork in 30 minutes in between class. Well, now it's like, I don't think we have 15 minutes in between class. So we learn how to adjust and do things differently. Part of it's workflow. And we really look at how can we help with our workflow. But in a virtual platform, when you're working to add a hybrid remote type of a solution for your cardiac and pulmonary rehab programs, think of it similar to a dimmer switch. It's going to be that slow incremental growth where you're bringing in 1 or 2 because it meets their needs. And while you're doing that, many programs that we work with are doing it with their existing staff. So it's just sort of taking the existing staff and folding in some of the virtual. And then as you grow, then it tends to be maybe 1 or 2 staff have some more dedicated time to manage that. And then as you grow even bigger, then you've also brought in more patients and more revenue. And now you can justify if you do need to bring in another staff, like perhaps a 0.25 FTE to manage those additional virtual patients.
Another question I hear a lot is, how are you keeping good contact with the patients that are only maybe coming in once every while? How do you know if, they're doing their exercises at home? How do you know, all the symptoms they're logging, that kind of stuff? We want to make sure that they're still in good contact, even though they're not coming in as often as the regular other patients.
Another wonderful question, Lauren. No, actually, we believe that we can have even more touch points with a patient who is in a virtual platform through the use of their smartphone technology. We have several hundred, if not thousands of patients who we've already enrolled into our platform. And the engagement between chat messages back and forth with their clinicians is very high. So we can always, reach out and just communicate to our patients. They can connect with us. They can ask us questions. When the patient is completing their exercise at home, which is something we're asking our center-based patients to do right now when they're not in front of us, instead of waiting for Monday morning to find out what they did over the weekend, the patients who have the app are already putting that data in. So I'm getting information even more quickly than when we have our patients on site. So we can stay connected through chat messages. We are notified, or the program is notified when the patient identifies a symptom. And so there's probably more touch points utilizing a smartphone and a virtual platform. I can also mention that many programs that have the software program for the virtual component are enrolling all of their center-based patients as well. So they're going through the traditional 3 times a week center-based program, but they're using the app for education, additional education, and they're asking their center-based patients to input their home exercise in real time. And so it's creating more accountability for that patient and just giving more information back to the program.
What is the best way for people to investigate if this is like a good solution for them financially and like clinically? What would you say the best thing for them to do to make that first step is?
Well, first of all, I think it's important to know your current program. And what I mean by really knowing your current program is how many patient visits do you have each year? What's your enrollment rate? And when I get to speak with programs throughout the country, it's really surprising that many programs don't truly know their enrollment rate. And there's 2 different numbers, and I think it gets confusing because we've got our enrollment rate of number of referrals we receive, and of those referrals, how many patients do we get into our doors? And then we've got the enrollment rate of total eligible. So there's a bigger pool of eligible patients who don't even get that referral to come to us and get into cardiac rehab. So we know that the national statistic is somewhere around 22% of all eligible patients with an eligible diagnosis actually enroll in cardiac rehab. That's a tough number to get. So even if you can start with understanding your current referral number, and of that number, what do you get? Because what you're trying to capture then is that missed group of patients who don't come in. That's your opportunity. And we know that it's financially positive. We know that someone above us is going to want to know, how is this going to, affect the financial sort of pro forma? But I'm going to speak to why we really want to do it. We really want to do it because we want to reach more patients. And that's why every one of you that are sitting here listening to this banter back and forth with Lauren and I, that's why we do what we do. So this is about reaching more patients in a way that we can have more engagement and ultimately impact the health of these patients over the long run. So don't be afraid of it. I would say too, people often think that it's going to not only replace center-based, it's going to replace their jobs and make us as clinicians at center-based irrelevant. I would argue that this makes us more relevant because we're reaching more, we're impacting readmission rates, we're impacting a greater number of patients. So look at your referral rate, look at your current structure, look at your why we do what we do, and then do not ever hesitate to reach out to Lauren and myself, and we'll work with you and we'll help you and we'll see if it would be a fit. If you're a tiny critical access hospital or a large academic medical center, there is a way that this can work, and there's a way that we can help you.
I also just want to again thank the MACVPR for having us today, and hopefully the next time we'll see you guys in person.